gallbladder disease, surgical removal is not the only option. Obviously, there are cases in which the gallbladder is so sick and even cancerous sometimes, or has gangrene, and obviously at that point, yes, surgery would be the best option. Please take it away. But there are certain phases of gallbladder disease that can be manageable in certain cases with diet and lifestyle and supplementation. And that's what we're going to go over, and also what you can do if you currently are in the middle of pain or acute situation, and how to prevent if you have one of the risk factors. So let's start understanding what the functions of the gallbladder are. And it's a pear-shaped little pouch that sits below your liver. So here on your right side, below your liver, and it basically receives the bile from the liver, concentrates it, and then squirts it out depending on what kind of meal you're having. And it squirts it out into your intestines. So it's also responsible for concentrating this bile to make it more effective. So bile is a liquid that's like kind of greenish, and it removes toxins from the body. It removes bilirubin, which is a breakdown of blood. It will remove estrogen and other hormones that are fat soluble. So all of the fat soluble toxins, you poop them out because bile carries them to your poop. So bile is super important. Your gallbladder functioning is super important. And yes, it is true that you can live without a gallbladder, but if you don't have that little pouch to concentrate the bile and to release it at the correct time, you're just going to have a constant flow of bile to your intestines, and this can lead to maldigestion and several symptoms such as gas, bloating, diarrhea, blah, blah. We're going to get to that. So there are certain risk factors that you cannot modify, but like I always say, DNA and your genetic predisposition is not your fate, because there are other risk factors that you can't. So being a woman, you're more at risk, being over 40, being overweight or obese, being sedentary. So being of certain ethnicities, Native Americans and Hispanic people tend to have more gallbladder issues. When you lose weight too quickly because of the fat mobilization that occurs in your body, you can also have either the sludge or the stones. Pregnancy, because of the hormonal shifts. If we think that estrogen is detoxified in the bile, then when you have shifts in hormones, then you could have a disruption there of the bile. Eating a high-fat diet, high cholesterol diet, eating too much sugar and refined carbohydrates, because this causes inflammation both in the liver and the gallbladder. When you eat very low fiber, because you don't have the excretion as well. And if you have family history of gallstones, if you have diabetes, because diabetes makes, when it's untreated and uncontrolled, it makes everything kind of move slower because of the vagus nerve. And then taking some kind of meds, certain kind of meds, oral contraceptives because of the estrogen content, hormonal replacement therapy because of the estrogen content, and other drugs such as statins can slow gallbladder function. So as you can see, most of these are modifiable. So if you're not active, you can exercise. If you eat a low fat, low fiber, high fat, high saturated fat, high cholesterol diet, you can change that. You can not be taking certain kinds of medicines that, or work to be not taking those kinds of medicines, such as statins, for example. If you're overweight or obese, you can lose weight, and you know the gist. So what are indications? Maybe you don't know that you have gallbladder issues. You just kind of feel weird. So I'm going to tell you the signs and symptoms so that you can identify if maybe you need to go get your gallbladder checked. And that would be an ultrasound, like an image. Then you would have pain right here on your upper right hand side of your abdomen. And that would occur about 30 minutes after you eat a meal. Obviously, if you eat a meal that contains more fat, the pain will be bigger and the discomfort will be bigger, right? Because the bile is responsible for digesting fats. You can also have something called deferred pain in your shoulder blade or in your back right here. Just because of the innervations, you would feel it in your back, which is kind of weird. So if you have a pain there that you already checked out and it's not muscular, it's not anything postural, it's not any lesions, then maybe you have to go if all these other symptoms also, or some of these symptoms also coincide. Itchiness on the skin. This is very interesting. Because of buildup of toxins, if you don't have correct bile secretion and excretion, you can build up toxins. Some people can build up toxins in their skin and get very itchy. So itchy things that are not rashes, they're not red, they don't have oozing, they don't have anything like weird coming out of them. It could be one of the signs that your gallbladder is kind of iffy. So fatty meals just make you feel awful. That's a good indication. If you have fatty stools, so the stools are foamy, they stink a lot, or if you have very pale stools, even whitish, because the bilirubin that makes the stools that color brown is not being excreted, your feces can actually be very light and pale. And your pee will get stronger in color, so darker, because your body has to find somewhere to excrete this bilirubin, so it'll do it through the urine instead when it was supposed to be going through the poop. So dark urine, light feces. This is probably in a more advanced phase. One very interesting indication as well is you cannot tolerate fish oils. So you either eat fatty fish or go to the sushi, or you take fish oil capsules and you keep burping it, and you just cannot tolerate that. So that could be an indication that your gallbladder is at risk. Constipation or diarrhea, it just depends on the person. And then again, I told you about the color of the stools. If every time you eat fats, maybe 4 or 5 hours after, your feces are like super foamy, super stinky, have fat oils and droplets in them, that's a good indication that you're not digesting your fats well. So you have to take a look at that. Dry, flaky skin as well. This can have a ton of other causes, thyroid issues, essential fatty acid deficiency, but it is one of the pieces of the puzzle when we are assessing all this. Gas and bloating after about 3 or 4 hours after your meals. This is because of all that fat that was, maldigested there, and the bacteria just feasting on it. So that could be an indication as well. Metallic taste in your mouth because of the toxins that accumulate in your body. Since you're not, excreting the bile correctly, there's that accumulation of toxins, and some people can feel a metallic taste in their body. They can even feel a little bit of jaundice in the eyes. The skin can be a little yellowish, sometimes subtle, sometimes not very subtle. Nausea and vomiting post meals. Some people have it when it's really bad. And then again, I talked about the dark urine already. So if you do identify, a few of these symptoms, just go get it checked. And like I said, all those risk factors, most of the risk factors can be worked on. And one interesting thing is how stress puts our body in flight or flight. I always say this, and it's not time to digest food if you're in stress. So your body just shuts down your stomach acid, your bile, your gallbladder contractions. So stress can be a cause of gallbladder issues. So a poor diet and all that. So one thing that I would like to say is for you, if you are in a crisis, like a pain, so there's a progression, right, from gallbladder. So bile starts, you start eating a crappy diet, and your content of your bile just gets altered to a bad side, and then it starts precipitating, and then you form something called a sludge. So the sludge appears years before an actual need for surgery. So if you catch these symptoms, and sometimes you can see a sludge in an exam, sometimes you cannot, but if you catch gallbladder issues in the beginning, you are able to prevent the removal of the organ, prevent surgery, and just prevent all of these bad symptoms. So there is a progression. So first you have the sludge because you altered the composition of your bile, because hormones, because too many toxins, because poor diet, because you're sedentary, because, all of those things that I talked about previously. Then your bile starts to precipitate, forms that sludge. If that sludge sits down there long enough, and it just can start forming crystals. Some crystals you can pass and you're not going to feel much except for very subtle pain. Some crystals can get really stuck there and you can feel awful pain. Some crystals can actually go to the pancreas and cause pancreatitis. It's just a mess. So definitely try to catch it before. And so what are we going to do? to support your bladder function. Sorry about that, I got sidetracked. So you want to eat a high fiber diet, always your veggies. You do not want to eat a lot of saturated fat and cholesterol, especially if you're having an attack right now. These herbs and plants that help your liver detoxify, such as those bitter ones, so artichoke, dandelion, beets, and green apples, they're all very good for gallbladder. Lean protein sources, right? Not too fatty. Teas can help your liver. Milk thistle, dandelion, gentian root, and all the other bitter teas, they help with gallbladder secretion, actually. And so it kind of helps get things moving down there. And then if you're really in the middle of a crisis, you can do a puppy pose from yoga, which you start on all fours, you kind of put your hands in front of you, and then you're going to bring your chest towards the floor and your butt up. So Google puppy pose yoga and you'll see what I mean. And sometimes it can relieve pain and even help move the sludge a little bit that's sitting there and get you out of a crisis. There's also other things that you can do. For example, rosemary diluted, rosemary oil, essential oil, you dilute it in a little bit of coconut oil, sesame oil, whatever kind of carrier oil you want, and you can actually rub it on the right side, and it helps with the detoxification. This is from Ayurveda. And so the general gist that I wanted you to come out from this talk today is, yes, while you can survive without your gallbladder, it is still an organ. God put it there and it has a function. And if you have it removed, your fat digestion will be compromised, and you might need lifetime support with things that help you produce bile a little bit more, or have a little shift in your diet, that you're not eating so much fat at one sitting, at one meal, kind of space it out a little bit, just so you don't have uncomfortable symptoms of bloating, of diarrhea, or of constipation. So that was it.